to a spotlight on an incredible and innovative Israeli organization, United Hatzalah. This is a network of over 6,500 volunteer medics who work to save thousands of lives each year across Israel and also worldwide. With an average response time of just 3 minutes or less, United Hatzalah provides free medical services 24/7. And now we have the pleasure of talking to United Hatzalah spokesperson Raphael Poch to hear a little bit more about this astounding work that their volunteers are doing each and every day. So Raphael, welcome.
Thank you. Thank you very. It's great to be here.
So tell me a little bit about United Hatzalah. What differentiates you from, let's say, other EMS, organizations?
So United Hatzalah is really a network of community-based volunteer responders who are fully trained and licensed by the Health Ministry and the Internal Security Ministry, and they provide emergency medical services. What we like to say is the 3 Fs: first, fast, and free. We have response times of, like you said, less than 3 minutes on a national average, in some places less than 90 seconds. That usually means we're first on scene. We're providing care for the patient between the time that the phone call is made and the ambulance arrives. Then when the ambulance team comes, we pass off the patient to them and really start the chain of survival a little bit early. And we're fast in incredible response times. We do that by the network of volunteers spread throughout the country. People leave their jobs, their homes, driving, wherever they are, they drop whatever they're doing and go and respond to a medical emergency. And they've taken it upon themselves to be on call 24/7, 365 days a year. So the response is often, we're the first people on the scene because we're right next to where the scene takes place. We don't have to leave from a dispatch center and drive to where the scene is. We're next door. We're the community member, the neighbor, the person in the next office building, et cetera.
So that's really incredible, because I wanted to ask, how is that possible to have such a fast response time?
So that's exactly it. It's really just people coming and dropping what they're doing, providing their response time, and when the ambulance shows up and the patient's taken care of and on the way to the hospital, they go back to what they were doing and pick it up from where they left off. And the other thing that divides us or separates us is that everything we do is free, completely free of charge. We never charge the patient. We don't even have a billing department for patients at all. And we exist totally on donations, so there's no charge for any of our services. And that's part of the idea, because we didn't want people to feel encumbered upon by the cost of an ambulance to receive care. If people need care, we want them to call to receive that care, and therefore we took it upon ourselves to provide everything for free of charge.
Incredible. And so tell me a little bit about, the volunteers that make up this organization. What type of people are they? People who can just drop everything and respond to an emergency in 90 seconds, 3 minutes, something like that.
So that's actually an amazing question. The people who make up the organization are everyone. It's people from all across Israel, all different backgrounds, religions, nationalities, ethnicities, everyone who feels that they want to go and help out when someone else is suffering. That's the type of people who join United Hatzalah. There's actually, as we're talking here in the studio, there's actually one of your fellow staff members is a volunteer of ours upstairs, by the way. So it's really just
incredible. So really, you guys are everywhere.
We're everywhere. That's the idea. And it's we have volunteers who are taxi drivers, volunteers who are obviously doctors and nurses. They're able to go out less, and they can't leave a patient to go treat another patient. So when they get a call, it bounces to the next closest person, and the next one goes. People are lawyers, bankers, but we also have people who drive trucks. And there's people who work in sanitation, and people who work in the city hall, and it's your neighbor, your friend, a family member, really everyone who likes to help. Mm-hmm. And usually when we find that when one person in a neighborhood or a community becomes a volunteer, then it has a domino effect, and other people want to become a volunteer as well. So it's a force multiplier.
And I want to ask, do you operate only in Israel, or is United Hatzalah, also in other branches around the world?
So the organization started here in Israel. United Hatzalah started here in Israel. The idea of Hatzala started in New York back in the 60s. It started here sometime in the 80s. And there are Hatzala groups around the world that are not connected to us. Each of those Hatzala groups have their own individual organizations in different places. United Hatzalah here in Israel became a national organization. It started out as another small organization. It became a national organization when a lot of people joined up together and decided that we're going to include everybody, men, women, Jews, non-Jews, Muslims, Christians, Baha'i, everybody. And then we realized that the mission of life-saving doesn't stop at Israel's borders. It goes beyond. So we opened chapters in Panama. We opened the chapter in Ukraine long before the war. And we opened it in Jersey City and a couple other places. We've also trained other EMS organizations and other governments how to implement our system. Right now, as this summer is taking place, there's a pilot project of running our system in Iowa, in the United States. The lieutenant governor of Iowa came to United Hatzalah headquarters, saw what was going on, loved the idea, and then started implementing it back there in rural areas to get volunteers to decrease response times and provide assistance. So the system works all over the world. In addition, what we've taken upon ourselves recently, starting from 2015, but a lot more in the past couple of years, was international relief and humanitarian aid missions. This really picked up in 2021 with Surfside. The Surfside building collapse, we sent a team, and then Ukraine, we sent a massive team. Included over 200 volunteers, and I can't remember exactly how many tons of humanitarian aid it was sent, and we sent 35 planes to bring in refugees. We're an EMS organization, and we're flying refugees back and forth across international borders. But the idea is we help wherever there's a need. And in 2022, we went on 4 missions. There was Ukraine, there was 2 hurricanes, one in Puerto Rico, one in Florida. And then a little bit later on in the year, 2023, went to Turkey with the...
So you guys are really all over the world, not just in Israel, all over the world saving lives. It's
correct.
Absolutely incredible.
Wherever we see a need that we can be of benefit to help others, we'll go and we'll show up. And it's kind of an amazing thing in that we're not, or an additional positive, that we're not a government organization. We're a nonprofit. It allows us a lot more flexibility. It allows us to maneuver and act quickly, even on international scenes, and to go places that the government doesn't want to go or can't go.
All right, well, Raphael Poch, thank you so much for joining us today and for sharing more about this incredible organization and the work that you do.
Thank you so much for having me.